Hello everyone, to all of you that are watching right now, Happy New Year. I hope that 2018 thus far has been a great year and here's to it being the best that it possibly can be. Thank you for watching my videos if you have been doing so. I hope they're informative and are helping you with your strengthening and stretching process. Just keep in mind that to get stronger and to get a good stretching habit takes time. So don't give up on yourself. Just hang in there and develop that good habit, because all it is learned behavior when it comes to stretching. Just actively doing it on a regular basis is going to actually compound that interest, making you feel better and getting the tissue to lengthen and to feel more stretched out. Today I wanted to briefly talk about some low back pain advice. So yesterday in my clinical setting, I saw quite a few patients who were complaining of low back and hip pain. And there's a common criteria that they all seem to have had, the people from yesterday anyways. There was some bending, some lifting, a little bit of bad posture, some slouching, and all those threads sort of came together in terms of the aggravating symptoms of what they were experiencing. A lot of those patients in particular did not sustain any falls or hits or motor vehicle accidents, so there's no trauma associated with their pain, which ultimately leads to sort of an insidious cause to their pain, meaning there's not one specific thing or action or movement that caused it. Usually it's a buildup of wrong mechanics of how you're using your low back in particular. So there is a common set of advice that I give to low back patients who fit that category. We want to change and potentially look at how you are sleeping. So sleeping position becomes important for the low back. If you are on your side, you should be putting a pillow between your knees. If you are on your back, you should be putting a pillow under your knees. That's going to take some tension off the low back, and it should be a habit that is regularly developed. So if you are having low back pain or you're not, it should be something that you are actively doing. Number 2 would be that you avoid slouching. It's so common and I see it so often, and people are aware that they're doing it, but I think sometimes they feel helpless in terms of how can they correct it, what can they do to make it better. And yes, there are treatments that are devised to help with someone's posture. I see it all the time in my daily clinical practice. It involves stretching the tight structures, strengthening the weak ones. It's an interplay between stretching and strengthening, and ultimately the best way to correct bad posture is to actively catch yourself and correct the position you're holding. So everybody knows what slouching looks like. It's rounded forward shoulders, it's a bent low back. So the way that we correct that is just keep constantly checking on how you are sitting or standing. If the shoulders are forward, you have to round them back. If the low back is slouching, you have to just physically straighten up. There's a lot of gizmos and gadgets out there now that have been popularized to help with positioning, like posture. One of the advice I give my patients is you can put a little sticky on your computer monitor. Now you have watches that are telling you every minute, every hour, stand up for a minute and move around. So the driving message home is that you want to actively engage in that correction. If you are standing or sitting with a good posture, that's great, keep doing it, keep moving throughout the day, don't forget about that part. But if you are not, like a sloucher, if you're slouching that is, you have to actively keep correcting it. You have to catch the position that you're holding and physically correct it, just like that. And number 3, no bending, lifting, or twisting. This is an advice that I give to all my low back patients. Oftentimes, it is the forward bend that did them in. In particular, yesterday, one individual came in and she said she was putting together some furniture, and it was a very light box that she had bent over to grab. So she didn't understand why is it that her low back went into spasm. She had a hard time getting up afterwards. And again, I tried to emphasize that one movement was the 10,001 time that she would have done it, that forward flexion, and her low back was just not strong enough with the buildup of time, it getting weaker, to be able to do that correctly. So it doesn't have to be a heavy box that you're lifting or as you're bending to lift. It can be a feather. It's just a physical forward bend in a bad position with your low back that does you in. My mother, throughout her back a couple of years ago, sustained a disc bulge, and it was by just bending over one day to pick up a throw off of the couch. And the throw would have been maybe 2 pounds. So the weight of the item doesn't make a huge difference. It's that forward flexion movement. When we correct that, a lot of times people think that it has to do with the knees. Now I have to bend from the knees. Yes, the knees certainly should be bent, but it's actually your hips that need to do the movement. So that's called like a squat position. And it's something that should be actively corrected every time. If you're bending down to pick up a pot from the lower drawer of your kitchen, if you are putting something away and it's on the floor and you're picking it up from the floor, you should be always bending with a squat. Forward bending is not the end of the world. It's what happens after you are loading the back in a potential lift, or sometimes it's coupled with a twist like a rotation. And bending and rotation together, especially when you're doing a forward bend, and then you're loading into your hands whatever object it may be, it's going to cause a potential compression on the discs. And so that is something that over time can add up and become a bad problem, like a bulge, a herniation, and so on. So ultimately, you don't want to couple forward bending or forward flexion with rotation in an unprotected back. So if your back is sort of fully forward slouched, and then you load those discs and those vertebrae by lifting something in your hands, that movement of reaching forward and grabbing to then straighten out, no matter how heavy or light that object is, it can actually do you in. So to recap, we looked at sleeping position, sideways or on your back, using the pillow appropriately. Then we looked at posture, avoiding slouching, constantly correcting your slouched position. And one thing to add with the posture is that you want to use the chair, the back support of your chair, to nestle your low back against it. That one is what will be beneficial in helping you put on a straight or neutral spine. And then lastly, we talked about avoiding bending and rotation or lifting from your low back. You should be doing it from your hips primarily, and then you can add your knees into it as well. So that's it. Those are my 3 tips for helping someone reduce their low back pain. It's something that actively we should be doing anyways, because ultimately prevention is the best, regardless of your day-to-day habits, your age, your activity level. So if you can prevent the pain altogether, why not? But in case that you are in pain, you can use these 3 tips to help see whether that's going to relieve your discomfort. And as always, you should be consulting with somebody, with a healthcare professional, when it comes to your specific type of low back pain. These are just some general tips that I found yesterday in my clinical practice. I was telling all my patients with this particular type of low back pain to be doing. So I hope that helps you all who are watching out there, and I hope you all have a great day so far. Thanks for watching.